Katrina Rothenberger, Public Health Division Director for Marion County Health and Human Services. So as of this morning at 8 o'clock, we have 1,697 cases in Marion County, which includes 1,623 positive tests and 20,672 negative tests and 51 deaths. I just wanted to make a note about the data. We run our reports every day at 8 o'clock in the morning, which is a different time than Oregon Health Authority runs their reports. So sometimes there are some data differences in the daily counts, but our total counts will always match up between OHA and Marion County. For the week of June 29th through July 5th, our percent of positivity rate was 9.9%, and last week was 7.2%. So we're starting to track these numbers on a weekly basis now. We no longer have the highest case count by population. We are currently at 48.4 per 10,000, and there are several other counties with higher rates per 10,000 than Marion County, which just is telling us COVID is spreading in Oregon. The state of Oregon is at 25 per 10,000. So we are over the Oregon state average for case count by population. If you look at our county indicators online, they were last updated on July 1st, and Marion County was meeting all 6 of those indicators. The goal for emergency department visits for COVID-like illness were required to be below 1.5%. We're currently at 0.7%. There was a downtrend in positive tests in the last 7 days when this report was run on July 1st at 6.2%. And the percent of new cases, the percent increase in new cases is supposed to be no more than 5%, and we saw a decrease of 17%. And the percent of cases not traced to a known source is supposed to be below 30%, and we were at 29% during that time period. And we've been really good about ensuring that we follow up with every case within 24 hours, and we're at 99% for this time period. So, and I was just looking at our most recent number of people who are assigned to our COVID response, which fluctuates as needs change. And we have 89 people who are directly responding to COVID in some way. 33 of those folks are in our disease investigation group, so they are taking on some portion of disease investigation, helping enter data, all sorts of pieces in the case investigation process, including contact tracing. And we are in the process of bringing on 20 new contact tracers, and we have 15 of those positions filled as of yesterday afternoon, and we're planning to bring on 4 every week. So it's kind of a lot to take on new employees, and so we think we can manage 4 new folks every week. So they'll be working in the ARIAS system. The ARIAS system is a new platform that's supported by Microsoft that assists with contact tracing and speaks directly to our case investigation software, Orpheus. So more folks will be able to get into the ARIAS platform. So we're looking forward to expanding that capability here over the next month and a half.
Just because I'm thinking of, we haven't really talked about all these new people. How about space? I assume you give them a laptop, but they need somewhere more than that. How's that work?
Yeah, space is certainly an issue for us right now. A lot of our employees are currently working remote, and so we've double booked their office space. And then we also have folks up in Woodburn. Public Health had vacated our Woodburn space, but we put folks back up there. And then as many people that can work remotely, we're going to have them work remotely. But I think, office space is certainly an issue for us, especially with the 6 feet social distancing.
Okay. Seems like you have a handle on it, but keep us informed what you need.
Absolutely.
Jan.
I know.
Excuse me.
Katrina, maybe you could give us an update on the hotel at this point. Still
Sure.
No guests in the hotel?
We do not have any guests in the hotel at this point in time. We have staff who are assigned to the hotel, and they're making sure that folks understand the safety protocols. So for staff, when they come in, they'll be doing a health screening, making sure they have plenty of personal protective equipment, and just preparing for the day when we need to put someone in the hotel for isolation and quarantine.
Good. It's a good update. Maybe we'll have that update every week.
That it stays empty?
Yeah,
That'd be
nice.
swell.
Yeah. But we've got it if we need it.
So anything, or are you finished with?
I am, yeah.
Anything else you're seeing, concerned about, or?
I'm curious to see what the 4th of July holiday will bring us in terms of new cases, but in terms of other areas of instability, I think we have a handle on most.
So it'll be next weekend before those really start showing up, if there is a rise?
Yeah, most likely this weekend, early next
I'll
week.
watch those too. You wanted to say something?
Well, I was just thinking, can we talk about the test that we're going to do, or the, what, research? Are we able to share anything about the research project with
Yeah,
University?
yeah,
Is it?
You can talk about what it is.
Yeah,
yeah. We
Right.
talked about it a little bit last week, but we're trying to put together an event so we can help the University of Oregon validate their saliva test.
was it, what school is that?
Well, we don't talk
right.
out loud. It happens. Things happen in this world that you can't explain.
Yeah, so you're working on an event that would help them with their 300 tests they need to get done.
Yeah.
Good.
All right? Anything else? Thank you so much.
you.